In today's Forward Focus, Kate Tillotson visits one county with a healthcare professional shortage and asks what's being done to improve it.
The village of Decatur is far from metropolitan. As a matter of fact, it's far from a lot of things.
There's lots of folks in Southwest Michigan and beyond that don't have reasonable access to primary or behavioral health care services when they need them.
Doctors Jennifer Harrison and Ann Chaplow work at Western's College of Health and Human Services. They've studied data compiled by HRSA, the federal agency for improving healthcare access for isolated people. In 2016, it found more than half of Southwest Michigan's 19 counties had a shortage of mental health professionals. Berrien County, shaded in red, was labeled high needs. HRSA also found more than 80% of the region suffered from a shortage of primary care providers.
And if you need a specialist, that might be where you have to travel 1 or 2 hours away to get to a specialist.
We traveled to Van Buren County, where the ratio of residents to primary care physicians is more than 2,000 to 1.
The southwest corner of Van Buren County is the most underserved. People who live here in Decatur have the least amount of access to healthcare professionals.
One more time. Decatur doesn't have anything around here, so a lot of people go to Pawpaw. It's kind of a long way. I feel like there's always a lot of people there.
Yeah, there's a lot of saw blades spinning, a lot of sharp things. I've kept all my fingers so far, knock on wood.
Doctors Harrison and Chaplow are working to fix the deficit. They were awarded a $1.8 million grant in 2017 to create the Interprofessional Peer Education and Evidence for Recovery Program, or IPEER for short. It offers $10,000 stipends to social work and occupational therapy students so that they start their careers in rural Southwest Michigan.
The whole goal is to incentivize our students to choose to do their field placement in a rural or medically underserved behavioral health area.
They've also created a mobile app to help bridge geographic disparities and allow patients to have regular contact with providers using telehealth as a tool.
One of the areas that we're pretty focused on is being able to do outreach to people in rural and remote communities so that they don't always have to drive into somebody's office.
The two are beta testing their technology this fall. They also plan to track their data to better determine if the app and the IPEER program improve access.
And we hope to be able to at least contribute in a small way to fundamentally transforming the way behavioral health services are offered throughout Southwest Michigan and to